Okay, my patient has been disclosed and she's rinsed. Now she's laying back. Now I'm ready to do my plaque control record. So I'm going to look in there and see where her plaque has stained. I noticed it has stained a little bit on tooth number 2 there. And let me wipe this down and get a close-up. Can you see that little bit of plaque back here in red right here? I don't know if you can zoom up on the camera. It's a little bit right here. So it's the distal of 2. So I would mark that on this form. Okay, I would probably mark the mesial of 2 right here. That's the interproximal. And a lot of people are going to have interproximal because that means they're not really getting the plaque with the floss. And see, I can take this and scoot a little plaque out on my shepherd's hook. Okay, and I'm seeing a little bit of plaque here on the mesial of 4. So what I'm going to do is I'm going to use my aseptic techniques and actually write little small dots on my charting. If you'll want to look over here on the charting, and I would write little small dots using aseptic techniques. I'm going to do a little dot on the mesial, and then mesial of, let's see, 3, and a little bit, she's got a little bit on, she had a little bit on the mesial 4, mesial of 5, and mesial of 6. So I'm going to make a little dot right here in places where she has it. I don't want to spend too much time with this. This should be very quick. Getting a plaque control record, you shouldn't have to sit there and hem-haw. Is it plaque or is it not? I don't see anything over here on the upper left, so she's doing very well here. Okay, she's doing, let's see, get my lighting on for the mandibular arch. Again, we want to have our patient in the proper position, maybe a little supine so I can see better. So I'm going to put her up a little bit. I really wouldn't count that plaque because that goes down into the pits and fissures. She's doing actually very well. Here's a little bit on the anterior tooth. This is, let's see, this is the first premolar, second premolar, first premolar canine, the lateral. So it's 23. She's got a little bit of plaque on the mesial. So I'm going to mark that. And she's got a little bit of plaque on the mesial of 24 and 25. Okay, so I'm going to put a little red dot in those 3 areas. Okay, so she's got those 3 areas in the anteriors. And I go back, let's see, I don't see any on the canine or the premolars. I don't see any on the first molar, number 30. But I do see a little bit on 31 here. And I can take my Explorer and just kind of get a little bit, and I know that's plaque. So I'm going to put a little bit on the facial of 31 and possibly on the occlusal surfaces. But there's really no area for the occlusal on this chart, so we're going to just put it right here on the facial. Okay, so those are the areas, and if you'll focus in on that and show, this is our plaque control record. Then we're going to use our little formula that I gave you in class to figure up her percentage. Looking at Miss Patel's teeth, her percentage is probably going to be very low. I would say maybe in the 10% range, which is a good plaque score. Okay, I don't know. I'd have to figure it up, but I'm just kind of guessing that her plaque score is pretty good. Okay, so, and I would be telling Miss Patel that, you know, I found a few little areas of plaque, and we'll go over it with our home care on areas that I found. And I would figure out my plaque control record. And now I don't really need my PPE on anymore. So I'm actually going to sit the patient up and explain to my patient her plaque score that I got, and we're going to go over home care.